The following video has been created to help you have conversations about nutrition in the hospital ward. Family members may have several questions about nutrition, such as, why does my family still have a feeding tube? How much is my family member eating? Are they on a specific diet? Can I bring in foods from home? Our nutrition guide also provides more information about nutrition and how it can help recovery. If you have questions, please talk to the dietitian on staff.
I'm wondering if I could ask you a few questions about my husband.
Oh, of course. What would you like to know?
I'm just wondering about that tube he's got right now. Can he also eat some food now that he's feeling better? I'm worried about him not getting enough nutrition.
Oh, actually, we've already started introducing food and drinks, but we're going to keep the feeding tube in for a while, just to make sure he gets enough nutrition.
Okay. But what about when he goes for tests? The feeding tube's not running when he goes for tests. Does that mean he's not getting enough?
Sometimes we do have to stop the feeding pump for certain procedures, but we always make sure it's running when it's supposed to. And of course, we are trying to get him to eat more by mouth so that eventually we will remove the feeding tube.
Is he having any problems eating or drinking?
Not right now, but we're keeping an eye on him, and we'll bring in a swallowing specialist, a speech-language pathologist if he is having problems. And if you notice that he's having any difficulties chewing or swallowing, please let us know.
I will. Do you know how much he's eating at meal times? I haven't always been able to be here to help him.
There are a lot of patients on the ward, and we don't have time to visit each patient during meal times. But it would be great if you or another family member are able to visit during those times. Then you can let us know if you think he hasn't eaten enough. But if you're not able to visit during those times, you might want to just ask him, see what he says, and then let us know.
Maybe I could bring in some of his favorite foods, to get him interested in eating.
That's a good idea. But you might want to make a list of those foods first, just to make sure they're safe for him right now. The hospital is a little limited in the variety of food it can offer, so a little bit of your home cooking could help.
Okay, I can do that. I'll make a list for you.
Great. You might also want to keep a journal by his bed. Then you and the family can write down exactly what he's eating, and that way we can all keep track.
That's a great idea. I'll get a journal today.
Great. Nutrition will make a big difference to his recovery.
Thank you so much for spending time talking to me today. Appreciate it.
Oh, you're more than welcome.